I'm Dr. Dhinesh David, consultant cardiologist in KIMSHEALTH, Trivandrum. So I'm going to talk about heart attack or myocardial infarction. All muscles in our body, our cardiac muscle, that is the heart muscle, also needs oxygen. But in heart attack, it can't get enough oxygen. So our heart is supplied by arteries called coronary arteries, which supplies the oxygen-rich blood to the heart. Inside the wall of the coronary arteries, there will be fatty deposits or the plaque, which over a period of time or as we ages, like it build up or it bulges, causing mild obstruction to the coronary arteries. But if it breaks, what will happen is there will be clot formation within minutes, which cause to completely obstruct the coronary arteries. So there will be complete cut off of blood to the heart muscle. So eventually the cells in the heart muscle will be starved of oxygen and the muscle will die. So this is called heart attack. If it didn't treat immediately, what will happen is there will be pumping function of the heart will be reduced and there will be abnormal rhythms and patient may end up in a sudden cardiac death. How will you know the patient is having a heart attack? So what we'll call is the symptoms. So patient will have a severe chest pain. So often the patient will complain of a tightness in chest or a squeezing type of pain, and usually the pain will radiate to the arms, left or the right arm, neck, shoulders, back. And sometimes they may have other symptoms like indigestion, nausea, vomiting, even abdominal discomfort. But usually in elderly population and more importantly in the women, so they will have entirely different symptoms. So there won't be any classical symptoms. So they may complain of like weakness or fatigability or like some lightheadedness. So these will be the symptoms usually in a women. But in a diabetic population, there will be a silent MA. Patient may not experience the classical symptoms. Once the patient is having a heart attack or patient is experiencing pain, so how will you confirm it? So immediately we have to take the patient to the hospital, immediately nearby hospital, and the doctors will examine with ECG, echocardiogram and cardiac enzymes. So if they confirm there is a block in the coronary vessel or in the ECG, we can locate the block. So immediately you will be taken to the cath lab. So in the cath lab, we will do the angiogram. In the angiogram, if there is any significant block in the coronary artery, we will be either doing a coronary angioplasty, or if there is a very critical disease or multivessel disease, in that case they may require a bypass surgery, which is called the coronary artery bypass graft. The important thing is, after the patient is diagnosed with the heart attack, so we have to give certain medications like aspirin, cloplet, which are called blood thinners, and we will be giving nitroglycerin, which will just dilates the coronary vessel. And there are certain other medications out there. And important thing is as we all know, the prevention is better than cure. We have to educate the patient. So we should always prevent before the disease comes. So how will you prevent? So that is called the lifestyle modifications. So we are daily we have to do exercise at least 30 minutes per day, or walking or in any form of exercises. We have to reduce your weight. Mainly the food control plays a major role. The reduced salt intake, food low in carbohydrates, low in saturated fats. And if you're a diabetic or if you're dyslipidemic or if you're having a hypertension, we have to have a good control of our diabetes or hypertension or our cholesterol. And more important thing is good sleep is very, very necessary. And most of the time we are seeing in very young population having heart attack, most reason is the stress. So de-stressing ourselves plays a major role.